All right, I've discussed on the program multiple times the World Health Organization and its attempt to move forward with two agreements that would expand its power in future health emergencies and pandemics. Now, these agreements, if finalized, could fundamentally change the relationship between individuals, their country's government, and the WHO. They're seeking to give the World Health Organization authority that overrides both the freedoms of individuals and the sovereignty of nations. Now, this is being done. All right, this is being done in the open, with full transparency, with the help of the Biden administration. So why is the legacy media ignoring all of this? I mean, this is quite significant. Joining me now to discuss this is Dr. David Bell. He is a public health physician who previously worked for the WHO, specializing in epidemic policy. He now is a senior scholar at the Brownstone Institute. Dr. Bell, welcome to Washington Watch.
Thanks, Tim.
So if you wouldn't mind, tell our viewers and listeners your background and experience with the WHO.
Yeah, I'm a public health physician by background. I worked for about 8 years within the WHO as a scientific officer and medical officer. On infectious diseases, I was one of the initial response to SARS when it came out of China and Vietnam, but mostly on malaria policy and diagnostics.
Are we right being concerned about this power grab by the WHO?
Yeah, we are very. This is a big change. It's an extension of what's happened over a couple of decades, but it's a big change in the role of the WHO, and it's a very clear. The intent is very clear to take over a lot of national health policy, and in a very restrictive way.
So as I understand what's being proposed, that they're going to be moving forward for ratification, if you will, or adoption next week, it not only allows the WHO to declare these pandemics, but then to essentially take over the controls for the member states in terms of what their response will be. That includes lockdowns, masks, vaccines, I mean, all of the stuff that would be related to a pandemic. Am I reading it correctly?
Yeah, it is. Next week is just a committee meeting. There's two things in process. One is the international health regulations are being amended, and these have been around for a few decades, but they were amended in 2005. And there's further amendments to these. They're going to be voted on at the World Health Assembly, which controls the WHO, in May of this year. There's a second one, a treaty, which is probably going to be voted on at May of next year, so a year later. So yeah, you're right. The amendments are the main thing at the moment to the international health regulations. These will centralize authority, not just for pandemics, but any health emergency, in the hands of the Director General, who's a person who's essentially put there due to diplomatic maneuverings at the head of WHO. And they also expand the definition of emergency to mean anything that he considers is potentially an emergency. So you don't even have to have people dying or a definite outbreak. There'll be a large surveillance mechanism put in place. This will find any new virus, any new variant, and he will have the power to then declare an international emergency and take these powers. The powers include much of what we've seen during the SARS outbreak. So they include closing borders, controlling travel, and down to even, and it specifies requiring medical examinations, requiring medication or injections. So these are very major powers from a person essentially sitting in Geneva to impose on anyone around the world based on his own definition of what a potential emergency will be.
Given the lack of clarity on that definition, I mean, you could declare climate change as an emergency affecting the health of people, could you not?
You could, and there's a lot of emphasis on this One Health approach within this. And One Health used to be, recognizing that some animal diseases spill into humans, but now it includes environment, climate change. It's even been discussed, as we know, within this country, that racism is a public health emergency. So essentially anything that, and the definitions are similarly broad within the current version of the amendment. So essentially anything that the Director General thinks may impact on people's health.
Final question for you, Dr. Bell, and I do thank you for joining us today. Can you give me some parallel of some other entity that has this much power?
Not really. I mean, the EU is going that way, the European Union, on its power over European countries, perhaps. But these are not powers that the UN normally has. It's not powers that certainly that have ever been seen in the health field. It's much greater powers than most national health authorities have over their own people. So this is extremely unusual.
Wow, alarming. Dr. Bell, thanks so much for joining us. Very insightful. We're going to be following back up with you. Thanks so much.
Thanks, John.